and it was very insightful. Telemedicine is indeed the need of the hour. So my question to our telemedicine speaker is, do you think that coming in the post-COVID times, when COVID will be gone, do you think telemedicine will still be a part of our lives?
Yep. Thanks. Maybe I can take this question.
Sure.
Yeah. So I believe that telemedicine will be the future of healthcare nowadays. So when we actually started off this particular project way back about 6 years ago, the use of smartphones and also apps were really something rare itself. But I guess if you speak to any patients today, they may have at least 10 to 20 different apps in their phones. And I'm sure with the pandemic itself, that has actually pushed the barrier for adoption even much faster. So when we started off the project, definitely there was a lot of barriers. But I guess with the COVID pandemic, this has sort of eliminated it. And I believe that this will be the future. And that itself is a good thing because you can actually now provide healthcare to many other marginalized as well as the rural population itself. And it's no more limited to geographical barriers.
Any other questions?
So thank you very much. Well, okay. So maybe can I ask one more question for the pharmacist, Mr. Lum? So I can see that you try to engage the patients and also the doctors by doing so many program in your Ramadan fasting and also in this pandemic thing. So are you okay if the patients, one of the patients ask you, can you give me the medicine? Because some of the pharmacists called me whether I can give a patient more medicines, which the patients actually, they didn't come to see me to consult, but they just want more medicine. Are you going to give for that kind of patients?
All right, so thank you for the question. So I think this is really, a very common situation that we face and we see even, in Singapore as well. The patient comes to you and say that I just want all the medications, just give me all this. I've been taking for a long time. So I think, this situation, and it is sort of like I would say is perhaps a culture in our setting where patients just come to you and ask. So I think what is more important is really to highlight, who are available for them to turn to if they need any advice. So as I've highlighted in my talk just now, I think one group of pharmacists that really is sort of not so well explored in terms of their roles is the community pharmacists. So, I mean, we can't really stop patients from saying that I want all the medications, for a whole month. I don't want to keep coming back to your clinic, especially in, during this COVID, not just we have an overwhelmed healthcare systems, but at the same time, we don't want to expose our patients to, this unnecessary risk as well. So I think the more important part is really to emphasize to patients that, okay, I can give you all these medications and, where you can seek help, the avenue, which I would say is the community pharmacists, who are basically located in the neighborhood in Singapore here. Yeah.
Good, thank you. So you will ask the patients to seek the doctor, or maybe also the nurse or Ms. Hussein can help that kind of patients who are really confused whether they should be meeting the doctor or not. So thank you very much. I think this is a very good session. Are you agree, Dr. Joshi? I think we should finish the session because we're already late. So thank you very much.
Thank you for chairing the session with me, and I thank Dr. Mohammad Asnain and the entire DAR team. They have been consistent over the last 10 years for getting out all the guidelines and continuously generating some very high quality evidence around diabetes and Ramadan. We congratulate them and thank you, ma'am. And thank you all our speakers. I know it's not easy in pandemic times. Stay safe and a happy 2022.
Thank you, Dr. Joshi, Dr. Sahai, Mr. Queen, Mr. Lum, and also Ms. Hussein. Assalamualaikum warahmatullahi wabarakatuh. Bye.